Hello everyone, my name is Christy Kirkland and I wanted to share with you the information on the health disparity of socioeconomic status in relation to obesity. In this presentation I will show you the correlation between people that are of low income or poverty level socioeconomical status and the rate of obesity in our population from the data collection from 2015. Due to the constant increase of obesity rates, we need to look at the obesity prevention and the social determinants that can be altered to change the outcome of obesity. The data and statistics collected will give us the insight of severity in the obesity rates, in particular urban communities and regions. Lastly, we will show the groups of particular people who are minorities who struggle with higher rates of obesity due to these socioeconomical factors. There are several factors that contribute to the association between obesity and socioeconomic status among adults. In this presentation, we look at the relationship between obesity and socioeconomic status in adults and how it varies from sex, age, and race. The minority of people that fall in the class were among the racial and ethnical minorities, Ganter 2016. The amount of people living 200% below the federal poverty level is 55%. And in that population, 77% are African American and 13% are Hispanic. Gofflin, 2016. Almost half of those populations are obese. The areas of population with the highest obesity rates are the uneducated with only a high school diploma, and finding answers and prevention methods are harder when people cannot afford the resources. Joplin, 2016. In our country, there's over 2 billion overweight people, and 600 million of them have a BMI greater than 30, which is considered obese. Levine, 2015. Those are staggering numbers. One of the main contributors of obesity is income. Being able to have a decent income comes from the capability of having a good job, and a good job comes with the ability to have received a good education. When people who are educated are well off, they take long-term high risks, such as putting money aside for food, particularly healthy food. They put money aside for insurance, health care, exercise, and college for their children. Whereas people who are poor and uneducated take short-term, low-risk chances like drug use, alcohol, tobacco, illicit, fast food, inactivity, and don't save money for college. Levine, 2015. Research question: is income and obesity? Are rates of obesity related to socioeconomic status? Research methods. To get this answer, we ran data sets and variables through the Integrated Public Use Microdata Series, IPUMIS USA, for 2015. In the IPUMIS system, I ran cross-tabulations and frequency distribution tables. I combined these tables and contributing factors to an outside source using my Excel and p-values. This data collection method allowed for comparison with BMI, the body mass index as an indicator for obesity, ethnicity and race, income levels, at or below poverty, WIC and welfare assistance, region, and education. This table shows BMI and income. The table to the right with the income below poverty level is higher than people who are not below. This next graph shows people who are below poverty level are less likely to exercise than those with a disposable income to spare. The number of people who receive WIC or welfare assistance is significantly higher than those who do not. People who are undereducated with only a high school diploma are also exceedingly more obese than those with a 2-year degree or a 4-year degree and higher. This graph confirms the CDC statistics where the North Central and Midwest and South have the highest rates of obesity. This graph shows how the population groups between the ages of 46 and 65 years old are equally the highest obese groups. The data shows how minority groups of African American, Black, Alaskan Natives, and American Indians are the most affected races in reference to obesity. In conclusion, all of the resources and data collected confirms the obesity epidemic in America. Obesity is a major problem, and poverty, resources, location, race, and age are all contributing factors. A recap of the graphs is that the highest group are poverty-stricken people, minorities of Black or African American descent, undereducated, with only a high school diploma, people on WIC and other welfare assistance, elderly because they are less likely to be physically active and depend on others for transportation. The p-values for all of our data sets was 0, which supports the hypotheses that obesity is related to the socioeconomic status that one is in. Thank you so much for your attention. I hope you found this presentation on socioeconomics and obesity informative, and here are my references.